Hey everybody, how you doing? Here it is, late at night again. Here I go. So I'm sitting here and I'm thinking, about things, this and that, and then I guess they're thinking about things, and I thought, well, hey, that's what this here YouTube's for, is to think about stuff and tell folks about it. So I thought, well, let me give it a try. I've done it 5-6 times now. A few other people have seen my videos. This one, I guess I'll go back to a bitter subject, and that's the wife and what had happened to her. And it really got me mad for a long time about, how what went on. And I'm sitting there thinking, I'm going, and, and my whole life I've been a mechanic. And the mechanics, the thing is, after about 30-something years of doing that, no matter what you meet up with or where you go or what you do, you're always looking for something wrong with it because you've done it all your life. Someone comes up and says, something's wrong with my car or something. You go, and they don't know what it is, and you got to find out what's wrong with it. So it's become a kind of a phobia or something with me. So I looked at the whole situation kind of as a dispassionate observer. And from what I saw, after I calmed down and had a look at the thing, I've come to the conclusion that I don't think medical care was what we lacked, and I think that we should take the health care issue in a wholly different direction. So I can get on with my story. What I think we should do is take and split health care into two parts. One would be health care, one would be medical care. Now the reason I say this is if me and the missus and folks that I know had better health care, we wouldn't need medical care as much. So I guess what I'm trying to say is not filling a need created a requirement, as it were. You didn't fill the need of, or we don't fill the need of health care, thus creating the requirement of medical care. I think we should start approaching things at a health care standpoint. The direction we take at it now, or that we're pursuing it, I think is the wrong way. It's like fixing the race car at the end of the race. It's kind of dumb, actually, if you think about it. Really, why are we fixing stuff that's broke instead of keeping things from getting broke? I have a solution to that. It's an idea I had. I'm going to go ahead and present it to some folks that I know around here, get their feedback on it, and because I don't want to be a big stupid idiot, saying something that's kind of dumb. I want to get some feedback. So anyhow, I think we should, oh yeah, let me get back on track. I got a bunch of time here. So, example. Okay, this here apparatus, everyone knows what they are. Okay, you see it? Okay, it's a cuff. It's a blood pressure cuff, right? This blood pressure cuff comes with instructions and handy carrying case. Isn't that nice? You know what? That's real fine. And I'll tell you another thing. I found this item at the Walmart for $9. Okay, this is going to be my rant and why I came to the conclusion that I put the conclusion in first, and then this should have been the first part. It's last. That's the way I work things. Anyway, I would think that, it took me all of 90 seconds reading this stuff, using this equipment, 90 seconds to learn how to take blood pressure. I'm sitting there wondering, well, why didn't, number one, my doctor tell me, hey, down at the Walmart, down on the bottom shelf in the corner in the dark, because that's where I found this thing, they got this blood pressure cuff. You need to take your wife's blood pressure periodically, make sure she's okay. Well, that sounds pretty logical to me. But, I found this 4 months after she died. If I would have been educated in health matters to where things that I could have taken care of, I would have had this. I would have been able to save my wife's life. Why wasn't I told that? Why? And I tell you, this is what I think should have happened. Every time a first-time subscription for blood pressure medicine comes up to the Walmart window, I think there should be a consultation on one of these $9 items given away free. Now, what Walmart should do, you counsel for all them other drugs, is counsel you and teach you how to take your blood pressure. I take my own now. Every few days, if I don't feel so good, I take it and see if I'm all right. And voila. Now, what they could do is when the doctor, say he prescribes this medicine, is this the first time you've had blood pressure medicine? He should know, but, let's go from there. He should subscribe on his prescription note, a person should go with you to pick up this prescription for this high blood pressure. And this person should be taught how to use this along with you. That way someone can take it or you yourself. There it is. Health care. I want to take care of my health, not my medical needs. And that's my rant for that, because I could have saved her life. And I think that, that was a shame. I found that so late. And the doctor should have told us. But since the doctor didn't, and since the doctor won't, apparently, we need to tell ourselves. Or, I have an idea. It's a really big idea. I'm going to run it by a few people, see what they think, and then I'll make a video with my idea written down. And I think they would solve 99.9% of the problems with healthcare / medical care that we have here. So, there it is. I know it didn't make sense, but I want to see how this works. So, see you next time. Bye.